Anesthesia refers to the use of drugs or other techniques to produce a temporary loss of sensation, consciousness, or memory during a medical procedure. The aim of anesthesia is to provide pain relief, relaxation, and control of the patient's vital functions such as breathing and blood pressure. There are several types of anesthesia, including general anesthesia, which produces a complete loss of consciousness, regional anesthesia, which blocks sensation in a specific area of the body, and local anesthesia, which numbs only a small area of the body. The use of anesthesia dates back to ancient times when various herbs and substances were used to numb pain. However, modern anesthesia as we know it today was first discovered in the mid-19th century. In 1846, an American dentist named William Morton successfully demonstrated the use of ether as a general anesthetic during a surgery at Massachusetts General Hospital. This event is considered the birth of modern anesthesia. Soon after, other anesthetics, such as chloroform and nitrous oxide, were also discovered and used for medical procedures. Modern anesthesia works by using a combination of drugs and techniques to achieve three main goals: pain relief, unconsciousness, and muscle relaxation. The specific drugs and techniques used will depend on the type of anesthesia being administered and the individual patient's needs. The three types of anesthesia are general anesthesia, regional anesthesia, and local anesthesia. For general anesthesia, a combination of drugs are used to induce and maintain unconsciousness. General anesthesia is a complex process that involves multiple drugs and mechanisms to achieve a state of unconsciousness and pain relief. It is believed to work by affecting the activity of neurotransmitters in the brain and spinal cord. When a patient is given general anesthesia, a combination of drugs is administered through an IV or inhaled through a mask or breathing tube. These drugs typically include an induction agent, such as propofol, which is used to rapidly induce unconsciousness. Other drugs, such as opioids and benzodiazepines, may also be used to provide pain relief and reduce anxiety. Once the patient is unconscious, a maintenance agent is often used to maintain the state of unconsciousness throughout the procedure. Muscle relaxants may also be administered to prevent muscle contractions and improve surgical conditions. The exact chemical reactions that occur in the body after administration of general anesthesia depend on the specific drugs used. However, some common effects of general anesthesia include: 1. Reduction of brain activity. General anesthesia is thought to reduce the activity of certain neurotransmitters in the brain, such as glutamate and acetylcholine, which are involved in consciousness and memory. 2. Loss of pain sensation. General anesthesia blocks the transmission of pain signals from the nerves to the brain, reducing or eliminating the patient's ability to feel pain. 3. Relaxation of muscles. General anesthesia can cause muscle relaxation, which is important for certain types of surgery and helps to prevent muscle spasms or contractions that could interfere with the procedure. 4. Depression of vital functions. General anesthesia can also depress the body's vital functions, such as breathing and heart rate, which is closely monitored by the anesthesiologist throughout the procedure. For regional anesthesia, a local anesthetic is injected into a specific region of the body, such as the arm or leg, to block sensation and pain. This allows the patient to remain conscious but not feel pain in the area where the procedure is being performed. Specifically, the drug blocks the action of sodium channels in the nerves, which are responsible for transmitting pain signals to the brain. This can cause a temporary loss of sensation, including the ability to feel pain, pressure, or temperature. Some common effects of regional anesthesia include: 1. Nerve block. The local anesthetic drug blocks the action of sodium channels in the nerves, preventing the transmission of pain signals to the brain. 2. Vasodilation. Regional anesthesia can cause blood vessels in the area to dilate, which can improve blood flow and reduce bleeding during the procedure. 3. Reduction of inflammation. Regional anesthesia can also reduce inflammation in the area, which can help to speed up healing and reduce postoperative pain. 4. Minimal systemic effects. Regional anesthesia has minimal systemic effects, meaning that it does not affect the patient's consciousness or vital functions in the same way that general anesthesia does. Local anesthesia is a technique that involves injecting a local anesthetic drug into a specific area of the body to block sensation and pain in that area. Unlike regional anesthesia, which can block nerve signals over a larger area of the body, local anesthesia is typically used to numb a smaller, more focused area, such as a tooth or a small skin lesion. When a local anesthetic drug is injected into the area where the procedure is being performed, it diffuses into the surrounding tissue and begins to block the activity of the nerves in that area. This can cause a temporary loss of sensation, including the ability to feel pain, pressure, or temperature. Effects of local anesthesia are commonly similar to those of regional anesthesia but in a scaled-down manner.